In order to flatten the curve of coronavirus spread in Ogun State, the state government has released a schedule for free testing of residents across the 20 local government areas. Each testing point has been allocated with medical officers and scientists who would work on rotational basis to ascertain the status of citizens who would turn up for screening at the dedicated venues and dates for the designated exercise. In a statement released by the Chief Press Secretary to the Governor, Kunle, the government urged those who fall within the Center for Disease Control case definition, especially those with symptoms, to step forward and be tested for free. This, according to him, will reduce the possibility of community transmission. Special Advisor to the Governor on Public Communications, Remi Hassan, joins me now on the news. Thank you for joining us on TVC News at 7, Mr. Hassan.
It's my pleasure.
Yes, this free testing, is it the same as the Ogun State walking and driving test program that is in partnership with the Flying Doctors Initiative?
They're all together. It's a whole gamut of testing initiative that the state government has put together. But concentration is going to be more on the border communities with Lagos, because such areas and locations have high incidence of human presence in terms of population. So the mobile testing centers will move around the entire nooks and crannies of the state, but the driving will be for majorly the communities that borders Lagos.
So what numbers are you expecting to achieve with this program, with this approach?
As an instance, and in taking off, we're looking at between 300 and 1,000 per day in terms of each location that we get to. And at the end of the day, it is going to still be based on the willingness of the people. That's why the advocacy, the awareness through the traditional institution, through the mass media, through the community-based stakeholders has been heightened at this point, so that people will understand why it is important to test. But at the end, it is still going to be the choice of the people to come forward and be tested.
Now, the reason I ask that is because despite Ogun State's proximity to Lagos, which is the most impacted state in the country, it has 35 active cases, low compared to other states that are recording increasing cases of the coronavirus. Now, has the state been lucky, or because prior to this program, it wasn't testing enough?
Prior to this time, what we've been doing is to test the contact of those that have been discovered to be positive, and as well as those who willingly came forward, probably because they found themselves to exhibit certain symptoms that suggest that probably they are infected. That has been the level to which we have gone in terms of testing. And of course, some few people too who came into the country through our borders with the international communities, especially the West African sub-region, have also been discovered to have tested positive on the land. That has been the case. But because of our proximity to Lagos, we are not in any way undermining the fact that we are vulnerable. And that is the essence of this initiative, to step up our testing so that we will know exactly what is the prevalence of this virus within Ogun State.
Mr. Remi Hassan, thank you for talking to us.